Today, this short discussion is talking about managing water. 8 classical strategies to affect dampness in our patients. Dampness is an interesting concept in Chinese medicine, and certainly it is a very frequent diagnosis. Dampness is both a cause of and a manifestation of illness. And it may seem very easy to recognize the symptoms of dampness in our patient. But we cannot simply say that our patient has damp and thus we will treat it without questioning how are we going to treat it. So I'm going to start by saying that dampness is simply water that must be managed, or rather, dampness is water that is not being properly managed by the body. If we think about water in nature, there is water where it should be, and then there are problems when water is where it should not. Water should be abundant in our rivers and streams, and we notice its absence. There is water that is more static in our ponds and lakes, and we want those places to be full of water and not overflowing. There's the ebb and flowing movement of water in our oceans, and we can track and predict its movement. And there's also water vapor that leads to humidity and fog in the air in the mornings and the evenings. Water droplets can gather to become clouds, and eventually liquid water rains back upon the earth, refilling the ponds and the streams. So water in nature has many forms or phases, if you will, and the changes of these phases are crucial. Water is a crucial element for life, but it also has a state of balance where it is in the right volume, the right concentration, the right movement or the right form in the right place. Too much water, too little water, too much fog or too heavy of a rain. All of these things can be catastrophic. Now the same is true for water in the human. Water is a necessity, but if it is not getting to the places that need it or is pooling in places where it should not be, water in abundance is not necessarily a good thing. We call this pathology. And the varied landscape of the body means actually that the correct form and phase of water in one place may not actually be the optimal form or phase or volume of water elsewhere. For example, in Chinese medicine, we say that the spleen abhors dampness, while the stomach abhors dryness. Water should not be tangibly held in the lungs. That's a pathology. While water is supposed to be held and more tangible in the kidneys and the bladder. So just like we can understand the inherent difference in climate and thus how water acts in the desert compared to how water acts in the tropics, we can understand that the body also has a varied landscape, and thus water can act differently and be in different phases optimally in different places. So as our medicine is actually a nature-based medicine, I would like to offer a few slides to illustrate what I mean about different forms and concentrations of water. In this picture, we can see that fog is blocking our view. And certainly water can act like this in the body, as if there is a fog or a mist in the body. Fog as an analogy, as a metaphor or a simile to understand, looking at nature outside of us to understand nature inside of us, we could agree that fog like this would confuse the mind, create a muffled sound of the voice. A person with fog or humidity in the body may not be able to see very clearly. They may not hear clearly. It may affect their sense of taste. Their orifices are thus actually clouded or fogged by the mist. In Chinese medicine, we have a condition called phlegm misting the mind. And that sounds very esoteric, but phlegm misting the mind really looks quite like this picture. literally a mist, a fog that is blocking clarity. This is one form of water that is not being managed optimally in the head or in the upper jowl. And in English, this is exactly what we term brain fog. If fog like this was in the middle jowl, we can understand why one's appetite or their absorption and elimination would all be affected. The tongue would certainly be puffy. The belly would easily be bloated. If the clear yang cannot rise and the turbid yin cannot descend, anything that enters this foggy, humid landscape of our digestive organs would not be metabolized, absorbed, or excreted optimally. If we use this picture of fog to imagine a foggy climate of a middle jowl, it's not unreasonable that a patient may start to have food sensitivities, fatigue and heaviness, poor stools or weight gain. It's also not unreasonable that they begin to think that gluten or soy or meat or dairy are the culprit. But actually the culprit was the humid landscape. It was the change in how water was being managed, more so than any one particular food or allergen. Imagine this picture as an analogy for fog or humidity in the whole body. Mist to the organs, mist in the channels or in the orifices, mist and humidity in the joints or in the flesh, even between the toes. So using this simple picture of nature as an analogy, we can see that fog or humidity could be in one location or could be systemic. And certainly many of the symptoms that I've just discussed, we could call those symptoms of dampness. Here on this slide, we can also call this fog, but you can see that the water is acting differently from the previous picture. The clouds are settling low across the hills. They follow the contours. The hills are blanketed with moisture, yet there is clear, crisp air above. I chose this picture to illustrate how water can be humidity dense and settling into pockets of yinish places, where a fog settles down into the places where the qi does not move as well. And yet again, there is clear air just above in the same landscape. Hopefully this picture of analogy and metaphor and simile shows us how there could be fog or yinish qi, moisture and dampness settling into the nooks and crannies of our body, settling into our joints, settling down into our feet. If fog like this settles into the lower jowl, we could understand how the lower body would feel heavy while the upper body does not. We can understand symptoms like cloudy urination, fullness and distension, discharge, even fungal infections. And again, this analogy shows us that while there is fog settling in one place, there is a whole lot of sky with no issue. How one would affect a landscape that looks like this in the body is different from how one would affect the landscape of the previous picture. Here, this third image is again quite different. Everything in this picture is soaking, saturated. If we apply this example to the human, we can consider if someone's body is pervasively wet, systemically wet. If a person's body was this deeply soggy, we could understand how the tissue would be prone to growing mold and fungus, festering and even rotting. This image can represent deep, pervasive dampness in one particular body, but it also could represent this level of dampness everywhere. And this is not just mist, this is saturated wetness. The leaves are soaking, the moss is soaking. How we would affect this level of wet in the body is again very different than how we are managing water in the previous two pictures. So with these three pictures of water in nature, We can see that water looks different. Water acts different in nature. It has different forms and patterns. And thus, it does also in the human. We can see just with 3 examples that there are actually many variations of water pathologies in the body, both in terms of form and its phase. And I want us to remember to look at nature as our guide to help us understand, because Chinese medicine is based on nature. It was understood through nature, and thus nature is our best teacher. So dampness is a word I am asking everyone to rephrase as the concept of a different phase of water. And how we would treat that phase of water is quite different. For example, humidity in the body, leading to muddled thinking, muddled seeing or hearing, sinus blockages, digestive symptoms, heavy body and fatigue. This type of humidity may need a very different treatment strategy. We may need to be aromatic. We may need to create light movement. We may be using spicy herbs and warm herbs to enliven the qi, to move the mist, like when the sun comes out and warms the air. Water that is more liquid or substantial, in contrast, may actually have to be drained out, exited out, chased out from the body. Humidity may need to be transformed, but liquid water can actually be forced to exit through the urine or through the bowels. On this slide, I have the word phlegm also as a phase of water. And phlegm certainly is a pathology of yin. The fluids have become thick or condensed or static in a place they should not. So when we see phlegm, often the treatment strategy is to change it, to transform it. Depending on the quality of phlegm, sticky and dry phlegm often has to be wetted and thinned, whereas wet and cold phlegm often has to be warmed and dried. The last word I have here as a phase of water is cold or static fluid, similar to ice. Now, water that has changed from a liquid to a solid because of a temperature has a very different quality than liquid water or fluid. Now, we may not really have ice cubes in our body. Our blood may not solidify. But again, using analogy, simile, and metaphor, we can understand how the fluids of our body will change or respond to the influence of cold. Cold will lead to our fluids being more condensed. They will not move as quickly. The tissues will condense. The water stops flowing the same. Even the blood can become thick or clotty. If the tissues contract, the body becomes stiff enough and the water becomes stuck enough that the body is quite rigid. This leads to pain and palpable cold sensations. And so in this situation, when we see that there's a water pathology because of cold, often our treatment method is to warm and scatter the cold, and the water will resolve on its own. So if we look at these words with a brief introduction to that concept of affecting humidity versus liquid versus phlegm or ice, here we have 8 vocabulary words in Chinese that teach us there are varied ways to manage water. So the first one we have shenshi, or to leach or seep out water. That is different conceptually than li shui, or to flow or uninhibit. Li niao, or tong lin, is coursing, actually unblocking. It's a much more active word. Chu shui is to expel water. Zao shi, again, this one is drying. So drying something is quite different than having it leach out. Hua shi is to transform, different also than hua tan. So how we're transforming dampness or how we're transforming phlegm, we have to actually change it. And then the last one is to expel, or to pai shui or pai nong, to get these phlegm nodules or pus out of the body. Now, you may have already heard these terms today or thought about these action words when you've studied herbs, but I want to present them as the key to our treatment method. These words should be guiding how we are treating a water pathology. Are we turning to herbs that leach or seep fluids out? Or is our treatment method to powerfully expel? If we are transforming humidity, it's almost like taking the fog and turning it back into clear air. Again, a very different treatment method than if we are drying out dampness in the body, more like hanging clothes in the wind on a hot day on a clothesline. These action words give us ideas on what our method of treatment is. The how are we going to affect dampness? And therefore, they are requiring us to choose herbs with very different flavors and nature. And this is very different in perspective than simply saying I'm going to tonify the spleen or I'm going to drain damp. Herbs that leach water have a different flavor and nature from herbs that expel or dry damp. Herbs that greatly stimulate spleen qi, in contrast, are often sweet herbs. They're nourishing herbs. Those herbs do not actually affect dampness as much as they add to the body, like food, dazao and huangqi, gansao. So sweet herbs are actually not on this slide to affect managing of water. We don't see tonify spleen to manage water. So we really have to pay attention to the actions of these words and consider what our strategy is when we're diagnosing damp. Hopefully, focusing on these action words also guides us to understand what is the speed of change and the potency of our formula. Leach, for example, is a passive word. So herbs that leach or seep water are often much slower or less potent in action. Leach means the water is seeping downward, sort of like water leaking through the soil after watering plants. It's a passive action. Expel, in contrast, is actively pushing water out. If we are expelling water as our treatment method, the patient should know that is our desired result, because they may have very exciting stools, they may have increased urination, they may be encouraged to vomit, or the patient may be looking for sweat as the sign of change. Transform, in contrast, means we are not often exiting water from the body. The patient may not have a larger bowel or a stranger urination. We're just changing dampness into not dampness. We're transforming its form. The fog becomes clear. Maybe a slight queasy of a belly goes away. The slight congestion of the head disappears. These kinds of things. So each situation, each of these action words, requires a treatment that matches the location of that water pathology and the phase of water in that location. So using these vocabulary words as our strategies, we are guided to herbs and formulas quite differently than saying formulas that treat damp or formulas that tonify the spleen. So let's look at a couple of these herbs in their categories from books that we have today. On this slide, I have herbs that flow or uninhibit water. These are the substances that are leaching or seeping out dampness. And we can see on this slide that the Neijing tells us that the bland flavors are acting like this in the body. It is the Huangdi Neijing that tells us that it's the flavor of the herbs that create an effect upon the qi. It is a predictable, repeatable effect. And today we may say that those flavors relate to the chemical compounds of the herbs, and that's certainly not wrong. But long before there were more scientific perspectives of microscopes and doing chromatography, the ancients were able to understand the effects from the flavor, and we are tasting the components of the herbs when we taste them. So bland flavored herbs are leaching, they're more passive, they are seeping out dampness. And it's the bland, starchy quality of these herbs that lends to a thickness. The herbal tea sort of descends and seeps and leaches. We have things on this slide like Fuling and Yi-Ren and Zixia. These are, as single herbs, these herbs are affecting the body in a more passive way, as if we are lessening the water. If there is sluggish gathering of qi and yin, it's as if the herbal formula gets a little bit starchy and heavy, and as the qi settles down, the water seeps and leaches with it. Somewhat like osmosis, that it creates this thicker, heavy descending. As single herbs, these are great substances to consider for sensitive patients or for long-term use. Because they are mild, like foods or supplements, mostly classified as upper herbs from the Shenlong Bancao, that means that they are not powerful, they are not toxic, and upper herbs are able to be given to a patient in larger doses or for longer periods of time without harming the patient. This is what the Shenlong Bancao tells us about upper herbs. So this is great information to understand the safety, but it also indicates that these herbs are not creating quick changes. They are subtle. If they're safe enough to be given a long term, like food or supplements, they are not going to expel water from the body if we need to make a change in the matter of a few days. So these are great to consider with that concept of seep and leach. And they are great to consider when our patient is either very weak and they need something very mild and bland because something too strong would be damaging to them. Or if patients are very sensitive, often these are herbs that are a good starting place because they are so mild that patients that are very reactive are not reacting to these herbs at first, and we can make a subtle shift. When we look at these herbs, just the picture of these herbs, we can see that they are dense herbs. They are heavy in their plant nature. And so that creates a yinish quality. Yinish substances act in a yinish way. And so they do affect a more downward, seeping, descending manner. And they have this bland, starchy, mild flavor. This picture shows the white color, and you can see the bland, somewhat starchy inside, but perhaps it doesn't represent the flavor, which I think is really the most profound thing about these herbs, is a very bland, but not a bland flavor in terms of a no flavor, lacking flavor, but a bland flavor in terms of bland as its own flavor. If you can think about having a bowl of oatmeal that doesn't have any goodies, no sugar, anything else, just that kind of starchy blandness, like a rice congee, something like that. That's what these herbs taste like when they are brewed. Now, I don't have Yumishu or Xiangjiapi on this slide. They were on the list of the slide before. We don't use those in our clinic. My teachers did not prescribe those, and I don't have clinical experience with those. So these are the herbs that we use quite frequently. And again, this is a great picture to show of the density of the Fuling and the Zixia and the Yi-Ren. They do have a dense yin quality in terms of their plantness. But as I said, because they are more seeping, more bland, they do not have a very strong property of flavor. They also don't have a strong thermal property. So if these herbs need to be in a formula where warming is the focus of treatment, often these herbs will be combined with herbs that are more palpably warming, things like Guizhi and Baiju, for example. In formulas, you can see that. If somebody had a lot of heat and they need to be cooled down, then these herbs can be combined with other herbs that are more cooling for a more palpable thermal effect. So these herbs, because they are so mild, they may need to be potentiated in action if we need to be more warm or cold, or if we need to be more drying. So something like Wuling San is a great example where ginger and cinnamon make a much more warming formula, and then these herbs can be the bland and seep. Here on the next slide, I have a list of herbs that are said to unblock and course to flow. And in Chinese, these are actually discussed as herbs that are purposefully unblocking Lin conditions. So blockages of the urinary tract system, whether it is a blockage of heat or damp or a stone in the tract, those kinds of things. So we know that just from the action word to unblock, to course and flow is much more active in action than to say to seep. These herbs are often considered diuretics, and they do encourage urination. Now, most of them, they're not toxic, so they're not something we have to be afraid of necessarily, but when we're creating an active effect upon the body, that's more potent, and that means that we should use these herbs when needed and cease them when the condition improves. These are not inherently things that we should be using for a very long time. More like middle level herbs from the Shannon Bansao that we want to use when the situation is appropriate, but they are not supplements that someone should be taking for a long time. So these herbs on this slide encourage a more robust urination, sort of like the difference between a river and a brook. For example, in a tiny stream, the water may not be strong enough that it takes away all the sediment on the sides of the banks. Whereas when the flow of a river is quite forceful, sediment won't gather. The leaves and the branches and the muck will be moved away from the forcefulness of flow. So I think about these herbs like that, using this analogy. The herbs are encouraging urination with the direct result of sort of pushing away the sediment, of unblocking Lin conditions, something that's stuck in the ducts. If somebody has sediment in their urinary tract or in the bladder or in the kidneys, we want to wash away that sediment. And so we want to have a more active flow and unblock. So the action word to li niao, or to flow, or to uninhibit, means that we do use these herbs purposely to create urination in the service of getting out sediment or making the pathway flow better. And so we should share that with our patient. We are expecting them to have perhaps a more refreshing pee or a more voluminous pee, that it should seem like it's clearing things out, and that they should expect to see that change. Here we have a picture of some of these herbs on this slide, and you can see that most of these herbs are actually also bland and neutral flavor, but there is a little bit of bitterness in some of these herbs. And so these herbs actually have a light, a flowing, and unblockingness. You can see the row of herbs on the right side. We have the mutong, we have some tongsao. They are so light and so yangish. They are able to really flow through the body and create good movement of water. If we compare those to the three herbs on the left, it's very interesting because these three are very sandy, very tiny seed material, as if the seed can get into blockages and to help move the sediment away. So the lightness of the plant quality in both of these situations, they're both very yangness, so they can get into and penetrate. The light bitterness of the flavor of some of these herbs allows it to drain and flow. But these also have a slippery quality, which I think is important. If you think about having a stone in a straw and you were trying to blow the stone through the straw. If the stone gets stuck in the straw, imagine what that would feel like if we're trying to get sediment out of the ducts. And so the slippery quality of these herbs and that light flowing quality is very important, so that we're sort of slipperying out what is stuck internally, which is a great explanation for the use of huashe in a lot of formulas, which is unblocking. In this group of herbs, we see the action word eliminate. And eliminate is definitely a little bit more of a powerful vocabulary. These are the herbs that we're going to see in formulas when dampness is often lodged in the flesh. We may think of these herbs solely as herbs that treat wind damp, but certainly wind and damp is another manifestation of a water pathology. So these herbs are mostly acrid and warm. Most of them are vines and woody pieces of material. Here we can see in this slide, I have 3 pieces of wood, the pine, the mugua, and the duhua. The way that these work is very much like their woody material as a natural plant. Wood has to flow through the xylem, and the phloem has to be able to grow and extend. That's very much like our muscle and tendon tissue. And these herbs definitely have a very potent, acrid, warm quality. If any of you have qianghua or duhua to smell, if you smell those herbs, just the smelling of those herbs really exemplifies the quality of this category. The incredibly spicy, incredibly warming, incredibly unblocking. It's kind of like, I don't know, like one of those mechanized robotic floor cleaners zooming around the house kind of thing. It has that powerful moving. The 3 herbs that are on the top of this picture, these are actually vines and things that their job in nature is to clamber on top of and hold on to and even sort of get into something to be able to climb on it. So in terms of the qualities of the plant, the natural qualities of the plant, it makes a lot of sense that these herbs are able to flow and unblock through the flesh. So in nature, their work likes that, and in the human, they really can get into the channels, get into the muscles, and expel damp out of the channels, chase it out of the joints, alleviating bee syndrome, alleviating pain in the flesh. But because these herbs are more powerful, more warm, more acrid, more flowing, more active, they can be very drying and irritating long term. So they are herbs that we want to use to get things moving in the body, get things flowing, but we want to be careful of, especially someone that has dampness in some places and dryness in other places. These herbs do tend to make good movement systemically, so their wonderful properties of being acrid and spicy and moving also means that that spicy, moving, flowing property can be drying and damaging. On this slide, we also have herbs that eliminate, and these are very similar to the herbs that I just talked about, except for these herbs that are vines and woody pieces are cooling. So the simple difference between creating an acrid, cooling flow, unblocking and expelling through the channels, different from something that's acrid, bitter, and very warming and drying through the channels, really is the difference between creating a warming thermal effect or a cooling thermal effect. And I want us to remember that picture of the fog settling down over the hills. These herbs are great for getting down into the contours of the body. We don't want dampness to lodge in the joints. We don't want dampness to lodge in the flesh or seep into the organs. So we have to have that flowing quality of them. On this slide, these herbs are said to transform dampness. And transform really is an interesting vocabulary word that guides us to understand a treatment principle. Transform means that we're changing something. We're changing its form from one thing to another. Transform doesn't mean expel or purge or dry or drain, really. It means we're changing it. So we're changing what is damp or what is humid or what is wet or what is sticky into not damp, wet, humid, or sticky. And how these herbs work is through their incredibly aromatic properties. The essential oils that are in these herbs are the most noticeable properties of the herbs. If we look at these pictures here, we have the incredible aroma of hopua, magnolia bark. We have 2 different kinds of a cardamom. We have sharen and we have tsaudoko. We have baiju is standing in our picture for tsangju. We don't carry tsangju in our clinic because it's so expensive that we use baiju more often, and then we'll potentiate it if we needed something. Tsangju is definitely much more aromatic and drying than baiju. And then potentially the loudest herb on this slide is the huoxiang or patchouli. And if you all can think about the smell of patchouli, that essential oil smell, that deeply penetrating, stay put smell, that really exemplifies the qualities of this category. The strong fragrance, the aroma is so deeply powerful and lingering that it goes in and aromatizes, if you will. It gets things moving, the chi gets moving, the damp gets moving, the blood gets moving, everything kind of gets this moving. Very much like if someone was unconscious, we use smelling salts, and it is the unbelievably penetrating aroma of smelling salts that's even able to get into the orifices, into someone's consciousness, and bring them back, spirit into body and awakening. So the herbs that transform dampness really are incredibly aromatic. And in that transforming, it's a really interesting change where also someone can have a little bit of a swampy belly, feel a little heavy, brain fog, a little sinus, and they take something that has that light aromatic property, and it's as if the fog was cleared almost miraculously. So these herbs are really wonderful to think about in terms of how we are transforming, which is, again, different than tonifying the yang of the spleen or deciding that we're just going to dry. Now, because these herbs are so aromatic, they are often very, very drying. So this is something that we want to be protective of the patient's yin, use them very short term, and make sure that we're balancing our formula so that we don't damage the yin in other places if they're not systemically humid. On this slide, we have herbs that are said to uninhibit dampness and recede yellowing. And recede yellowing basically means they're affecting jaundice. They're affecting that when there's dampness that's been kind of clogging the pipes, clogging the liver, the gallbladder, there's bile backup, there's dampness and heat backup. That to uninhibit this dampness allows all the pathways to flow, allows the liver and the gallbladder's function to return to normal. So not only is there not dampness in the body, but there's not this idea of yellowing or jaundice happening. Now, if you look at these herbs here on this picture, you can see how light they are. Certainly the top two, the Yin-Chen-Hao and the Jin-Chen-Hao. The third herb here on this slide is Hujang, which actually is fairly light in quality when you hold it in its hand, but it doesn't have that same super fluffy quality of the Yin-Chen and the Jin-Chen-Hao. I like these herbs, and I think about them as if they're sopping up dampness or soaking it up. Yin-Chen-Hao is something that Dr. Chun would use all the time in dermatology, especially when there was dampness and kind of pussy skin things, weeping eczemas, very wet and kind of where there's fluid within whatever's happening in the acne or psoriasis or those kinds of things. So the quality of these herbs is very, very light in the hand, very yangish in plant nature, but actually quite lightly and lingeringly bitter. So as if they go in and kind of soak up the dampness, and when the dampness is not blocking, everything else can flow. They are definitely a little bit drying in nature, and I think about these herbs when the damp is more wet damp, liquid wet, less about phlegm. If it was phlegmy, sticky, then we may need to thin out that phlegm, and these ones are sort of more drying it. And so once that water is moving or uninhibited or soaked up, then the liver and the gallbladder function optimizes and yellowing resolves. Here on this slide are herbs that are categorized as clear heat and dry damp herbs. And I think these herbs are certainly among the most famous for treating dampness, and probably are the herbs that people think of first for treating dampness. People will probably think of Baiju first to tonify the spleen, and then maybe some of these, the Huang family yellows. I purposely put this slide at the end because I want everyone to note that so far we've talked about how bland flavors can seep out dampness, how aromatic flavors can enliven and transform damp, how acrid and warm flavors and vines and woody things can expel dampness through the channels. Even the last herbs that are very kind of light and soak up dampness, this lightness of plant quality, clearing the organs that are blocked and clearing the pathways. So here, as we have arrived at herbs that are very, very bitter, all of these herbs are intensely bitter, among the most bitter herbs that we use in Chinese medicine. They also are very, very cold. Huangqin and Huanglian and Huangbai, certainly Longdancao, incredibly cold and bitter. So I hope that when we diagnose dampness from this moment on, we can remember there are many other flavors to consider. And I say that especially because in my practice recently, I have seen so many people that come to me. They have been diagnosed with gut dysbiosis, SIBO, candida. They've been told they have mold toxicities, and they're very worried about killing the molds and killing the candida. And quite often they are prescribed these herbs or a formula that is very heavy in cold, bitter herbs. Recently, patients have even told me they've been prescribed simply berberine pills, which is where we're getting that ingredient is from some of these bitter plants. Oregon grape is quite common. Herbs that are binding molds is quite common. Herbs that are killing candida, very common recently. And often what I find is that the cold, bitter herbs are incredibly damaging to the patient's system, very damaging to their digestion, and the patient is interpreting their additional discomfort as a good sign that the molds or the candida is being killed. So I think that we really need to understand that these herbs are palpably intensely bitter. They literally dry up dampness as if they soak it up so fast. If you haven't tasted Huangbai or Huangqin, taste some and note that the mouth immediately will feel more dry. The stomach will immediately feel more dry. The water didn't leave your body. It didn't go anywhere. You may not have noticed a different pee or a change in your bowels, and yet often you will systemically feel like, oh, there's water is gone. It has left. So in order to use these herbs that are that cold and bitter, there really has to be enough pathogenic damp, enough wet dampness, that herbs that dry the dampness are effective and don't begin to then dry the person's yin or their tissues. Often when we use these herbs, there's because there's some heat and toxicity, and it's so important to treat the heat and toxicity and sort of resolve the pathogenic influence that we might actually damage the patient, but our job is to get a way to treat the pathogen really fast and then solve our damage to the patient second. Those are situations where our treatment is very short time frame, maybe only a couple of days, an acute situation where the toxicity is more dangerous to the patient than the damage from cold, bitter herbs. But I do really feel like these herbs have become so frequently used that I have started to share the following analogy with my patients who come to see me diagnosed with molds and are on a predominance of the herbs you see here on this screen. I tell them that here I live in Asheville, North Carolina. It is a temperate rainforest. And so most houses do not have a basement. We did build a basement that has open air on one side of the building. We built a brand new house, and we've now lived in that house for 5 years. And there's already mold spots on the wall in the basement. We didn't have anything stored next to it. We didn't have any water there. Nothing abrupt happened. It just happens to be a wall that's completely enclosed in the ground in a place that tends to be very moist. And if we do not run dehumidifiers in the basement all the time, all the year long, I'm sure that our furniture that is down there, the carpet, the other walls would mold. Now, does that mean that I want to pull out mold killing sprays and spray it all over my wall? Because really, that's what's happening when people are taking a lot of cold, bitter herbs, especially like Huanglian or Longdancao or those kinds of things. It's kind of like coming into the basement every other day and just dumping bleach on the walls to kill the mold. And I feel like what people overlook is that the mold in my basement is not pathogenic. It's growing because the climate is optimal for it. And so the best way to change the climate of my basement is to keep it really dry, and therefore I have a dehumidifier sucking the moisture out of the air all the time. What does that mean for our treatment with our patients? How are we changing the landscape of their body, of their abdomen, of their whole body if they tend to have that idea of humidity, fog systemically? Often warming and drying them systemically is going to be the best way to disallow molds, growths, water accumulating. And that's very different than just giving them constantly very cold, bitter herbs that are meant to attack the mold. So this is definitely something that in pop culture, maybe in 10 years it will be less relevant, but I have found that especially relevant now. So I want us to think about these herbs, these very bitter, very cold herbs. They are incredibly effective. They are very, very powerful herbs and great to use when we need to, when there is heat, when there is water, when we really need to dry and clear, but they're powerful enough that this should not be something that someone is taking for months or years. So I want to return us back to this list of our vocabulary words to guide us to understand the concept of managing water. What are our treatment strategies based on where the water is not being managed well in the body? What is its form? How will we change it? What are the herbs that are specifically listed to do these things in our modern books? And how would we balance that in our formula? Hopefully that gives everyone some great food for thought and is applicable right away to the clinic setting. Thank you for joining me.